Your immune system spent decades protecting you, fighting infections, destroying abnormal cells, healing wounds, maintaining the internal environment of the body against a constant stream of threats, and it did this quietly, effectively, without recognition. But after 60-something changes in the immune system that most people never hear about, not from their doctor, not in routine health conversations, and almost never in the health content designed for seniors, the immune system does not simply weaken with age, it changes in character. The changes it undergoes, collectively called immunosenescence, produce a specific pattern of dysfunction that simultaneously makes the body less effective at fighting new threats, while making it more prone to generating inflammation against its own tissues, less protection, more self-attack, and a chronic background of systemic inflammation that drives many of the conditions most associated with aging. Today we are going through what immunosenescence actually is, what it does to the body, what research is finding drives it faster in some people than others, and what interventions have the strongest evidence for slowing it. This is not about fear, it is about understanding the system that determines your health resilience over the next decade, and giving it the conditions it needs to function as well as possible for as long as possible. What immunosenescence actually is. The immune system has two main arms. The innate immune system, the fast, non-specific first responder. It detects threats immediately and produces a rapid inflammatory response. It does not learn. It responds the same way to every threat. The adaptive immune system, the slower, highly specific learning arm. It produces antibodies tailored to specific pathogens. It creates memory cells that allow faster, stronger responses to threats encountered before. Its cells, T cells and B cells, are the basis of immunological memory and the mechanism by which vaccines work. Immunosenescence primarily affects the adaptive immune system, specifically the T cell population. T cells are produced from precursor cells in the bone marrow and mature in the thymus, a gland in the chest. With age, the thymus gradually involutes, shrinks, and becomes less active. By the age of 65, most adults have a thymus that is producing only a small fraction of the T cells it produced at its peak. The result is a gradual accumulation of old, exhausted T cells, cells that have undergone many divisions, have shortened telomeres, and have reduced functional capacity, at the expense of a fresh, diverse, responsive T cell population. This exhausted T cell pool responds less effectively to new pathogens. It responds less effectively to vaccines. It is less capable of recognizing and destroying abnormal cells that would normally be cleared before they develop into cancer. At the same time, the innate immune system, the nonspecific first responder, becomes chronically activated, not in response to specific threats but as a background state, a persistent low-grade inflammatory activation that occurs even in the absence of obvious infection or injury. This chronic, low-grade innate immune activation is what researchers call inflammaging, the convergence of aging and inflammation, and it is now understood to be a central driver of almost every major age-related disease: cardiovascular disease, type 2 diabetes, Alzheimer's disease, osteoporosis, and cancer. The immune system that was once protecting you is now, in this chronically activated state, contributing to the very processes it was designed to prevent. What drives immunosenescence faster in some people? The pace of immune aging is not fixed. Multiple factors accelerate it significantly, and most of them are modifiable. Chronic infection, particularly cytomegalovirus, CMV. Cytomegalovirus is a member of the herpes virus family. It infects the majority of adults over 60 and then establishes lifelong latency in the body. The immune system maintains a permanent low-level vigilance against CMV reactivation, and this persistent vigilance, the allocation of a significant proportion of T cell capacity to monitoring CMV, progressively crowds out the T cell diversity needed to respond to other threats. CMV seropositivity, having been infected with CMV, is associated with accelerated immunosenescence and reduced vaccine responses in multiple large studies. It is one of the most significant drivers of accelerated immune aging that has been identified. CMV is transmitted through bodily fluids and is extremely widespread. Most adults are infected without ever knowing. Its relevance is not in avoiding infection, which is largely impossible retrospectively, but in understanding why immune aging accelerates in some individuals faster than others and why the immune support strategies below are particularly important in CMV-positive individuals. Chronic psychological stress. The relationship between psychological stress and immune function is one of the most robust findings in psychoneuroimmunology. Sustained elevated cortisol, the hallmark of chronic stress, directly suppresses T-cell function, impairs antibody production, and drives the chronic innate immune activation that characterizes inflammaging. Research following carers of Alzheimer's patients, a population under sustained chronic stress, consistently shows faster immunosenescence, shorter telomeres, and reduced vaccine responses compared to age-matched non-carers. Managing chronic stress is not merely a quality of life recommendation, it is an immune system intervention with measurable biological consequences. Physical inactivity. Moderate regular physical activity is one of the most consistently validated anti-immunosenescence interventions available. Exercise reduces circulating inflammatory markers, it maintains a more diverse and functional T-cell population, it supports thymic function, and it reduces the accumulation of senescent immune cells. The operative word is moderate. Intense exhaustive exercise, chronic overtraining, can transiently suppress immune function. Moderate aerobic exercise, 150 minutes per week at a pace that allows comfortable conversation, consistently shows immune benefits in studies of older adults. Poor sleep. Sleep is when the immune system consolidates its memory. Cytokine production during sleep drives the consolidation of immunological memory responses. Chronic sleep deprivation reduces natural killer cell activity, reduces T-cell proliferation, and, critically for older adults, significantly reduces the immune response to vaccination. Research has shown that individuals who sleep less than 6 hours in the days following vaccination produce substantially lower antibody responses than those who sleep 7 or more hours. The vaccine provides the stimulus, sleep provides the consolidation. Nutritional deficiency. Several micronutrients are critical for immune function and commonly deficient in older adults. Zinc, required for T-cell development and function. Selenium, required for antioxidant defense in immune cells. Vitamin D, which regulates both innate and adaptive immune responses. Vitamin C, required for neutrophil function and antibody production. Deficiency in any of these does not simply reduce general health. It specifically impairs immune cell function in ways that are directly measurable and that are correctable with appropriate supplementation. What the evidence supports. Vaccinations. The most directly evidence-based intervention for compensating for immunosenescence is appropriate vaccination, influenza vaccination, pneumococcal vaccination, shingles vaccination, and for those eligible, COVID-19 booster vaccination. The immune response to vaccines is reduced in older adults compared to younger ones, a direct consequence of immunosenescence, but the response, while reduced, is still clinically meaningful and protective. And the higher dose and adjuvanted formulations of flu vaccine developed specifically for older adults produce meaningfully better responses than standard dose formulations. Being fully up to date with recommended vaccinations for your age group is the most direct available intervention for the reduced pathogen-specific immunity that immunosenescence produces. Regular moderate exercise. Sustained over months and years, this is the most powerful lifestyle intervention for slowing immunosenescence that research has identified. Not a specific program, not a specific sport. Consistent moderate aerobic activity plus resistance work that maintains muscle mass. Sleep optimization, 7 to 8 hours of good quality sleep, non-negotiable for immune function at any age. More important at 60 and above than at any earlier stage of life precisely because the immune system's consolidation and maintenance functions are most dependent on sleep in the context of a less robust baseline. Dietary pattern. The Mediterranean dietary pattern, olive oil, vegetables, legumes, fish, nuts, moderate unrefined carbohydrates, has the most consistent evidence for reducing chronic inflammation and supporting immune function in older adults. It provides the micronutrients most critical for immune cell function and reduces the dietary drivers of inflammaging, particularly refined sugar, ultra-processed food, and excessive saturated fat. Targeted micronutrient assessment. A blood test checking zinc, selenium, vitamin D, and vitamin B12 in adults over 65, and correcting identified deficiencies through diet and targeted supplementation directly supports the immune cell functions that are most impaired by these deficiencies. Stress management with genuine social connection, not stress reduction techniques in isolation. Genuine social connection, the kind that reduces the chronic psychological stress that chronically suppresses immune function. The relationship between isolation, stress, and accelerated immunosenescence is not metaphorical, it is biological, and the intervention, genuine connected relationships and purposeful activity, is the most available and least expensive immune support available to any senior.